Understanding blood pressure. Seven million people in the UK have high blood pressure. For every 30 to 40 people who have their blood pressure checked, one person will find out they have high blood pressure. In Gateshead, around 6 out of 10 people who have high blood pressure could have prevented this with lifestyle changes. Your heart is a muscle that pumps blood around your body. When your heart beats, the blood is moving. This is called your pulse. Blood is sent to every part of your body through tubes called arteries. The blood presses on the sides of the arteries when it moves. This is called blood pressure. Your blood pressure changes throughout the day. It is normal for your blood pressure to go up when you are moving around. We measure blood pressure in two readings, for example 120 over 80. The top number, in this case 120, systolic, measures the pressure in your arteries when your heart beats. The bottom number, in this case 80, diastolic, measures the pressure in your arteries when your heart rests between beats. Normal blood pressure is between 100 and 139 systolic and 60 to 89 for diastolic. A blood pressure test checks if your blood pressure is healthy or if it's high or low. Low blood pressure, also known as hypotension, is not usually a problem, although it can cause dizziness and fainting in some people. High blood pressure, also known as hypertension, can increase your risk of developing serious problems if it's not treated. Having this quick test is the only way to find out what your blood pressure is, and it could save your life. Blood pressure machines vary, but they are all a type of measuring device, which often have an arm cuff attached to it. The cuff is usually wrapped around your upper arm and filled with air until it feels tight. This can feel uncomfortable, but it only lasts a few seconds. It's important to relax and not talk during this time, because this is when your blood pressure is measured. An automatic device usually picks up the measurements from sensors in the arm cuff, which are sent to a digital display. You should get the results straight away. This chart helps you to understand if the blood pressure reading is low, normal, or high. If you get a reading and it's high or low, you should try and breathe calmly, check your sitting position, and not talk, and repeat the reading up to 3 times over 15 minutes. If the reading is still high or low, then it is advised that you visit your pharmacist or GP practice. Water makes up 90% of your blood volume. Dehydration can cause fluctuations in your blood pressure. It can both raise and lower your blood pressure, depending on how dehydrated you are and how long you've been dehydrated. You can get your blood pressure tested at a number of places, including most pharmacies, your local GP surgery. Some workplaces will also do blood pressure checks. A risk factor is something that increases your likelihood of getting a disease. If you have a family history of cardiovascular disease, you have an increased risk of developing high blood pressure. Men are more likely to develop high blood pressure at an earlier age than women. The older you are, the more likely you are to develop high blood pressure. Any questions?